Hello, everyone. I wanted to talk specifically to you about the proper management of drowning for whitewater kayakers. First, I want to introduce myself and explain to you who I am, my background, and where I come from. My name is Floyd Miracle. I am a paramedic. I've been a paramedic for approximately 10 years. I'm also an avid whitewater kayaker. I am a weekend warrior. But I do get out pretty much every weekend, and it's likely that I've seen many of you on the river. In my role as a paramedic, I've been a flight paramedic, I've been a firefighter paramedic, I've been a frontline ground level paramedic, and I've also been a wilderness paramedic. Currently, my role is in training other paramedics. So I produce videos like this routinely for my job to teach paramedics at my department, and I do this pretty routinely. But right now, I want to specifically address whitewater enthusiasts, whether you're a kayaker, you're a rafter, a raft guide, or if you're just someone that's a swimmer, or if you're just constantly in or around water. It might also be useful for parents or other outdoor enthusiasts. But why am I talking about this? Recently, there's been a lot of discussion in our community about how to properly manage patients or victims of drowning. And I have heard from many people time and time again that that we should not be breathing for them, that we should provide hands-only CPR. And just to add a little bit more credibility to myself, I am a CPR instructor. I can teach basic life support. I can teach advanced cardiac life support. I can teach pediatric advanced life support. And I will give you good references throughout this presentation as well. But what I have been hearing from people on how to manage drowning victims has been troubling me for a while, and I've been going on a campaign on social media to try to rectify the problem. But I think I want to put something out there that I can just share with people to give them a little more additional and maybe more interpersonal information on this topic. I hear a lot of people say, well, I know how to do CPR. And I'm just going to tell you that that doesn't reassure me a whole lot as someone who is a whitewater kayaker who's going to be depending on other people to save my life. I kind of want you to know a little bit more than that. Okay, if you've taken a local CPR course through your local fire department, maybe your club, or what have you, there's a good chance that they have emphasized hands-only CPR, which is just performing CPR without breathing for the patient or the victim. And there are some situations where that's appropriate. I've even heard from some whitewater kayakers that they have taken wilderness courses where they have taught hands-only CPR. And that, just to put it bluntly, is wrong. It's blatantly wrong. It's incorrect. And your instructor is wrong, and I would be happy to tell them that if you want to send me their contact information. This is usually the graphic you see from the American Heart Association. Call 911, push hard, and push fast. That's all you have to do to save a life. And in most cases, that's true, but that typically only applies to the 30, 40, 50-year-old person that dies suddenly, right? A vessel in their heart is occluded. There is no oxygen, nutrients, or blood getting to that part of the heart. Because of this, they have an abnormal cardiac rhythm that basically either ceases their heart from beating or it ceases it from beating effectively. Okay, it is not beating effectively enough to perfuse the brain and the rest of the vital organs. And in this case, when someone dies suddenly like that, their blood and their hemoglobin, which carries oxygen, the hemoglobin is already saturated. All right, so their body essentially has this big reservoir of oxygen. And when you do CPR, you are circulating that oxygenated blood throughout the body, and it takes a little while to go through, or for the body to utilize all of that oxygen with CPR. But this is not the same situation in which we're going to be resuscitating a drowning victim or your friends, or a situation in which your friends are going to be resuscitating you on the river. The situation is a little different. You don't die suddenly. You die through respiratory impairment over time. And actually, when you hold your breath, when you're underwater, you're going through that oxygen, that reservoir of oxygen that is circulating through your heart and perfusing all of your vital organs. So your oxygen levels start dropping before you even go unconscious or go into cardiac arrest. Now, the actual definition of drowning from the Wilderness Medical Society is the process of experiencing respiratory impairment due to submersion or immersion in liquid. And that's literally the only definition. You've probably heard of hundreds, and there are like over 100 different documented definitions, but none of them are medically accurate. This is really the only definition that matters: the process of experiencing respiratory impairment due to submersion or immersion in liquid. Now let's talk briefly about the pathophysiology. So what happens when you're submerged underwater? You hold your breath until you can't hold your breath anymore. Then you take in water, right? And then the water enters your mouth, and then you either spit it out or you reflexively swallow. And you can swallow large amounts of water. Usually the stomach is full of water, but the lungs are not. After that process, you hold your breath. That can last approximately 1 minute. That's a conscious response. You automatically do it until at some point you can hold your breath no longer. All right, and your body naturally, reflexively takes a breath. Okay, and the water during this process, some water goes into your airways. At which point laryngospasm occurs. What is laryngospasm? Well, think of your larynx or your vocal cords. They kind of spasm, which prevents water from further entering into your lungs. And at some point, your brain becomes hypoxic, or there's a lack of oxygen to your brain that terminates the laryngospasm. You continue to aspirate water, and you become more hypoxic, which means that you have a deficit, a whole body deficit of oxygen, and that causes you to lose consciousness and become apneic. All right, so there's no longer any drive to breathe. Now, this seems like a long, a complicated process, and it is. And I don't want to confuse you, but what's important here is that while you are submerged underwater, a pretty good amount of time lapses between when you go under the surface of the water and water actually entering the lungs, or significant amount of water enters the lungs. All right. So it could be that when you pull the victim out of the water, that there is little to no water in the lungs, but they are still hypoxic. They still have this huge total body deficit of oxygen. And what they really need is oxygen. That is the cure. That is the solution. And that is the fix. And you'll see this process is much different than the 40-year-old with clogged arteries who's waiting in line at McDonald's to get the Big Mac, who goes into sudden cardiac arrest from a heart attack. Okay, this is a totally different process, therefore it must be looked at differently and treated differently. And this is why in-water resuscitation matters so much. When I'm training my EMTs and my paramedics, I don't usually talk a lot about in-water resuscitation because it's kind of difficult to maintain their head above water and to actually put your mouth on theirs and breathe for them. And it's also generally not in our scope because it's not something that we're really trained to do, and we can quickly become a victim. But as a whitewater kayaker, this is something that I kind of expect from my group, that if you can get to me and bring my head above water and give oxygen, put oxygen from your lungs to my lungs, I want you to do that. So the key with in-water resuscitation is to give rapid provision of oxygen from your lungs to theirs. And providing in-water mouth-to-mouth resuscitation can provide a 3 times greater likelihood of surviving compared to you actually trying to get them to the land first to then perform CPR and rescue ventilation. Now, it's important to note that you can't really do CPR in the water. It's not going to be effective, right? You're going to push down and they're just going to go into the water. You're not actually going to compress the chest any. So if you think they need CPR, and especially if this is a primary cardiac cause of the cardiac arrest, meaning, maybe it was an elderly person that went in the water, their head never really went below the surface of the water, but maybe they clutched their chest or they just quit responding, then it could be a primary heart attack or a primary cardiac cause of the arrest, in which case it is more important to get them to land to initiate CPR. But there's a scenario that I keep thinking about, and I know a lot of people frown on the hand of God rescue. And I'm not sure why. It seems like it's something that's pretty easy to do. I'm not sure if it would be practical in many situations. But I just imagine one of my friends, going down a rapid, maybe they're upside down, they hit their head, they're unconscious, but then they come down to a pool. Maybe if I do a quick hand of God rescue and I can lean their head and body over on my cockpit rim and do mouth to mouth that way, it might be a situation. But the whole go, whatever you can do, you just want to get oxygen from your lungs to their lungs as soon as possible. And if you can't do in-water resuscitation, or it's going to be logistically difficult, then focus on getting them to land to provide mouth-to-mouth resuscitation then. And a lot of people ask, well, should I feel for a pulse? What if I don't know if I feel a pulse? Well, from firsthand experience, and there's actual good evidence to support this, feeling for a pulse is very difficult. That's why the AHA doesn't teach lay people to feel for a pulse anymore. Even for trained providers, sometimes one paramedic will feel for a pulse and then the other paramedic says they can't feel a pulse. I just had this experience the day of this recording. I didn't feel a pulse and someone else said they did. So you can't really depend on feeling for a pulse. I think that it would be good to maybe try to find a pulse, but if you're ever unsure, it is important to just remember that fundamentally, if they're not responding to you and they're unconscious, they still need mouth to mouth. And if you're unsure whether or not they have a pulse, you can just start CPR. Even performing chest compressions on someone who doesn't need it is not going to hurt them. The chances of them becoming injured from you pushing on their chest is infinitesimally small to the chances that you could help them. But again, the emphasis is on mouth-to-mouth resuscitation. So, and remember, the drowning process does not stop when you get them out of the water, right? Even if they only inhaled a little bit of water, that water hits the lung, all right, and the lung is coated with surfactant. Surfactant keep the alveoli open. They keep the alveoli from closing. When water hits that surfactant, which is like soap, it washes it away and it creates foam. That foam starts filling the lungs. So once you get them out of the water, the drowning process continues. So if you don't provide mouth-to-mouth resuscitation immediately, they continue to drown even without being under the surface of the water. And if you don't believe me, if you don't believe what I'm saying, this is directly from the most recent American Heart Association guidelines. You can look it up yourself. They say that arrest without a primary cardiac origin, i.e. from respiratory failure, toxic ingestion, pulmonary embolism, or drowning, are also common, however, and in such cases, treatment for reversible underlying causes is important for the rescuer to consider. And here are some additional excerpts from the AHA that you can pause, you can read through it. I'm not going to take the time to read through each of these because we've already talked about them in great detail, but I will highlight one, and it's the last point down at the bottom. All right, the last bullet point. The reported incidence of cervical spine injury in drowning victims is low. Routine stabilization of the cervical spine in the absence of circumstances that suggest a spinal injury is unlikely to benefit the patient and may delay needed resuscitation. I have my own personal opinion on spinal immobilization, and I will tell you from a pre-hospital and even in-hospital standpoint, we are de-emphasizing routine cervical spine immobilization. Your number one priority is to get them out of the water, to restore oxygen to their body, and to perfuse their brain. Okay? If you are concerned about a spinal injury, the longer they are hypoxic, the longer they go without oxygen, and the longer their heart is not beating or is not beating effectively, the greater the chances of them having a permanent and devastating spinal cord injury are. So if you really want to help them, what you want to do is get them out of the water as soon as possible, with or without in-water resuscitation, and properly resuscitate them and restore oxygen to their lungs and their body and perfuse the brain and the rest of their organs. So how do you save someone from drowning? Well, these are the steps. You stop the process of drowning, remove them from the water, but that doesn't necessarily stop the process. You have to get oxygen to their lungs. How do you do that? With either mouth-to-mouth resuscitation or mouth-to-mask, and I will show you how to do that. And then you perform CPR if it's indicated. Who should be resuscitated? So there are many times where someone might be pinned vertically, entrapped, or in a sieve, cave, something of that nature. And we get them out of the water, and we're not sure, what should we do? Should we attempt it? Is there any chance? This verbiage, all right, these quotes are directly from the Wilderness Medical Society, and I will let you look at that, and it might be important to make note of it and think that if I was in this situation and it took me 30 minutes to get my friend out of the water, should I attempt this or should I not? And this could be a good guideline for you. But always, when in doubt, attempt resuscitation. A lot of people think, well, with cold water drowning, the outcome's going to be good. That's not necessarily the case, because the problem with cold water drowning is, in our situation, it's very unlikely that they're going to become hypothermic first and then drown. If their body was able to get cold and hypothermic before they were hypoxic, then it would be beneficial. However, they usually drown and they get irreversibly hypoxic and have irreversible brain damage before their core temperature drops to the point where it can provide some neuroprotection. So you probably heard that they're not dead until warm and dead. That mantra is overhyped in this situation. In other hypothermic resuscitation situations, it's true, but in the cold water drowning, it's not as neuroprotective as we once thought. And those with good outcomes, they're usually submerged less than 11 minutes. And a lot of people may ask, should they continue kayaking? What if we're on a wilderness run, but we might be able to get help, we might not. Should they continue on down the river? Can they stay in their boat? And so forth. And the answer is that it depends on how severe their symptoms are. Do we need to call for EMS? Do we need to try to get to the takeout, wherever that might be? Do we need to evacuate them? So maybe they're in a very remote, week-long situation, and you're not sure if you want to evacuate them. There are risks sometimes with evacuation. But statistically, if they don't have a severe cough, frothy sputum, or foam in their airway, the mortality rate's around 0%. And of course, the worse their symptoms are, the worse their outcome will be. And here's a chart. You can find this on the Wilderness Medical Society guidelines for the treatment of drowning patients. I'm not going to stay on this slide for a long time. So how do you breathe for them? How do you actually physically get air to them? Well, on your left, there's a head tilt chin lift. It's literally, you lay them on their back, and you push under their chin, depending on which side of them you're on. Depends on which hand you're going to use. And you take the opposite hand and you tilt their head. So something like this, okay? So you bring that chin forward, all right, just like that. And then you need to be on the side of them if you're doing mouth to mouth, because you're going to pinch their nose and put your mouth over theirs, but yet their mouth kind of needs to be a little open, so you can actually grab the chin, push it up, and then open the mouth like that. And I have my own thoughts about if I would perform mouth to mouth on my friends that I'm with on the river because of COVID, and the short answer is yes. The long answer is yes, I would. And I hope that they would do the same. But I do recommend you carry an actual device that's made for providing that. They're commercially available. You should be able to find them on Amazon. They even have ones that have filters in them. But you need to make sure you get the one that's specifically designed for use in water. Otherwise, having a filter on it, and if it's not designed for in-water use and it gets wet, then it's rendered useless. But basically, the best way to perform this is to have their head basically between your knees, put your two thumbs down on the mask, reach your forefingers under the angle of the jaw and the mandible, and you pull that into the mask. And you want to make sure that no air is leaking from around the sides of the mask, and you just lean over and you breathe. So how much air do you give them? Well, you give them just enough for their chest to move, to go up and down. And that's it. When you see that chest rise, you stop and let it fall back down. How many breaths do you give them? If you're not performing CPR, and so maybe their heart's beating, maybe they have a pulse, you're not doing CPR, you want about 8 to 10 breaths a minute. About 8 to 10. If they don't have a pulse, well, many wilderness guidelines for the treatment of drowning recommend 5 rescue breaths before you initiate CPR. So how's that work? Well, you get them out of the water, put the mask on them, you give 5 breaths, 5 good breaths that go in and out, and then start CPR, at which point you would do 30 compressions, 2 breaths, 30 compressions, 2 breaths. And that is what I recommend, is 5 breaths. Now, if you have a lot of people standing around and you can quickly get someone doing CPR until another person gets the mask out or is ready to do mouth-to-mouth resuscitation, you can do that. But the priority and the emphasis is on getting oxygen to their lungs, because even if you don't feel a pulse, that does not mean that their heart is not beating. It just might not be beating effectively enough for you to feel a pulse. All right, so their heart could still be beating, but you just need to get oxygen to their lungs and their heart and their brain. And as a quick reminder, if you're doing CPR, just do it right. Even bad CPR is better than no CPR, but how do you perform CPR? Well, you put your knees next to their shoulders. You want to be as close to them as possible. You straighten your arms out, interlock your fingers. You're going to push with the heel of your hand on the center of their chest, right on their breastbone, in between their nipple line. All right, I'm locking my elbows. I'm bending at my hips. My hips are like a fulcrum. All right, so my elbows are staying locked. I'm pushing about at least 2 inches. All right, and when I come up, I make sure that the chest springs fully back. So the relaxation is as important as the compression. And I'm doing that about 110 times a minute. AHA says 100 to 120. I say 110. 110 is a good middle ground. Okay? And do you need to get water out of the lungs? Oh, I get this question a lot. No. One, I can't really effectively get water out of the lungs. They don't recommend the Heimlich or abdominal thrust because little water is actually aspirated in the lungs, especially if you get them out of the water quickly. They will have little to no fluid in the lungs. And it just delays you giving oxygen to them, which is what's going to save their life. You might see this foam, this frothy stuff coming from the lungs. Remember earlier when I said when that water hits the alveoli is like soap, and when you mix water and soap together, you get foam. This is what's coming out of the mouth. You can try to turn their head, tilt their head to the side, roll them over, shake them, turn them upside down, string them up by their feet to drain that from the lungs. But that foam's going to keep coming, okay? There's nothing you can do about it. You just need to breathe through it. You just keep breathing for them despite the foam. All right? And here's my email. You all can find me on Facebook, Twitter, or Instagram. I look forward to your feedback and your questions. I would be happy to make a video demonstrating how to actually do these techniques, but I just wanted to get this out there for everybody. All right, thanks for listening.